Hello, everyone. This is Dr. Weiner from Central Florida, and we all know dogs get into all sorts of things. Some can make them pretty sick. Today, we're going to discuss when your dog or when a dog gets into rat poison. Rat poison is one of those things where you definitely need to take immediate action because those can be detrimental and potentially life-threatening. Now, let's kind of break it down into different types of rat poison. The common ones are anticoagulant, which means you'll get some bleeding disorders where the medication or the product does stop clotting factors and clotting from forming, and then they get lots of bleeding issues. And then the other category, let's just call it non-anti-coagulant, those are mostly neurologic signs. So what do you do if your dog does get into rat poison? We need to take immediate action, and so you can call poison control, call the poison control hotline, and go to your vet, or go to your vet, or doing both at the same time. Now, I think the sooner we acted, the better the results would be. And some of these take a few days to kick in, but it's very important to start taking immediate action right away as soon as you notice your dog ate something, and not wait until clinical signs come back appear, because if that has already happened, we've lost valuable time to decontaminate and potentially get the dog over potentially life-threatening issue. So the most common anticoagulant type of rat poison we see is the active ingredient called Bromethalin. It's kind of like, or same family as warfarin. It's a vitamin K antagonist. Vitamin K is needed for clotting, so by preventing vitamin K, we prevent clotting in the dog. What that can look like is any sort of bleeding from any kind of orifice. So you can have nosebleeds, bleeding from the mouth, bloody diarrhea, bloody vomiting, bruises all over the skin that kind of appear suddenly. And sometimes they can bleed internally. If they bleed internally in the chest, you can notice some breathing issues or difficulty breathing. Another thing you might see is that their gums, they're pale. They're very, very pale. So if you notice anything like that, definitely come in right away. Typically, it does take about 2 to 5 days or so to kick in to see clinical signs. But again, better to come in as soon as you notice that the package has been disrupted. And you suspect, even if you just suspect it, good idea to bring your dog in or to call poison control and see what we can do about it. Diagnosis is usually with history of ingestion, and then we'll do some blood work, mostly clotting times. If the clotting times are elevated or just abnormal, that's pretty consistent with this Bromethalin toxicity. Treatment is mostly supportive care and also vitamin K supplements, which if we can get them through the initial insult, then they might be on vitamin K supplements for weeks, if not months. And then other things are, if they need transfusions, we can certainly do that for them as well. Treatment, if we catch it early, or sometimes, sorry, I forgot, sometimes we can make them vomit as well, if that's warranted in each case. Prognosis, if we catch it early, if we decontaminate them, they can do okay. Prognosis, I would say, is guarded to poor, but there is something that we can do about this one. We might be able to get over the insult and potentially be okay. So the other categories, the non-anticoagulant ones, one of the more common ones, kind of more up and coming one, is Bromethalin. And Bromethalin it kind of interrupts the nerve transmission of signals. So what you see for that is paralysis. You might see respiratory distress or arrest, where they can't breathe anymore because the diaphragm isn't working. Things that you might see: tremors. They might be hyperexcitable, where something that might be a normal, benign kind of touch or pet, they really freak out and overreact. Onset of clinical signs does depend on how much they eat. So the more they eat, usually the quicker onset you'll see. You'll usually see a quicker onset than the Bromethalin. So you can see it between 4 to 36 hours or so at the high dose. Lower doses, you might still take a few days, so 2 to 5 days or so. Let's see, diagnosis again is mostly based on known exposure to the toxin. We might do blood work, but that might not, that might come back unremarkable. So mostly it's just clinical signs and history of getting into the toxin. This one, treatment is mostly supportive care, but there really isn't any good reversal or anything that we can do about this one. So unfortunately, this one, Bromethalin, is definitely a grave prognosis. And going with all of these, they're all pretty potent. It does not take a lot to cause issues, so very low lethal dose. And so prognosis is often pretty grave on this one. Alrighty, the third rat poison active ingredient we're going to talk about today is called Cholecalciferol. It's another non-anticoagulant toxin that cholecalciferol is just vitamin D3, and what that does is it increases the absorption of calcium in the gut. So calcium in the bloodstream goes up that way. It also breaks down the calcium in the bones, which then goes into the bloodstream too. So excessive calcium leads to the buildup of calcium or calcification of tissues or organs, and what that does is it's painful, it hurts, but also can disrupt organ function. And since lots of different organs can be affected, like the kidneys, the liver, skin, you see kind of general vague clinical signs. So decreased appetite, lethargy, vomiting. You can see bleeding. If it affects the heart, you can see heart arrhythmias as well. With that one, the onset is a little quicker. It's 18 to 36 hours or so. Diagnosis again is based on known exposure. You can do x-rays on this one, and sometimes the kidneys kind of light up. The kidneys are very radiodense, where they kind of look like a mineral or bone density. So if you see that, it's pretty consistent with this cholecalciferol toxicity rather. Treatment again, supportive care, and just anything we can do to flush the extra calcium out of the body. There are some medications for that. If the dog does survive the initial insult, treatment with the calcium flushes can sometimes have to be taken for about a month or so. But prognosis on this one also fairly poor to grave. So as you can see, there are 3 different types, or several different types of rat poison. Clinical signs treatment is very based on which type. You wouldn't treat a Bromethalin the same as a Bromethalin. So knowing which one your dog got into, how much he may have eaten or she may have eaten, and how much they weigh, or and how long ago it was, are all very, very important bits of information to let your vet know, or when you're calling animal poison control hotline to let them know as well. Some things are being done to try to decrease the risk of exposure. So the EPA, or the Environmental Protection Agency, has done a few things like making baits less available and making these tamper-proof bait boxes or bait stations, but nothing is necessarily dog-proof. So prevention is definitely key when it comes to this sort of thing. So just keep it in not only out of sight or out of reach, or what we think would be out of reach with the dog, but completely in a different area. You know, if your dog has access to a certain room, don't put it in that room. Only put it in places where your dog does not go or has zero access to it. And also just following the instructions on the bait does help somewhat as well. So don't wait for clinical signs to appear. If you notice your dog got into a bait box or some rat poison of some sort, take immediate action, and you know, like I said, either call your vet, call poison control. There is a fee for poison control, but it's worth it. You have specialists and people who really know what they're doing. This is all they do is deal with like toxicities and things like that. I think, and they can really point you in a good direction. So if you have any questions or you're concerned about your dog getting to rat poison, call your veterinarian and take immediate action, and hopefully everything turns out to be okay. Take care.